Cancer affects everyone, regardless of age, gender, or social status. Because of the tremendous progress that has been made in the last decades, more than 50% of cancers can be cured. But there is still a group of patients with poor prognostic cancer. Only 50% will be alive after 5 years. We must turn over every stone to find solutions for these fragile patients. The Horizon Europe Framework Programme has created the Mission on Cancer to understand cancer better, allow for earlier diagnosis and treatment optimization, and improve cancer patients' quality of life during and beyond their cancer treatment. The EU has funded 12 projects on diagnosis and treatment. While each project treats a different type of cancer, they are united in their effort to develop pragmatic clinical trials to optimize the diagnosis and treatment of patients with refractory cancers. These projects are all pragmatic in their approach, but they still must prove their effectiveness. Once they do, they can be easily implemented in clinical practice in an affordable way. The Strixit-2 project is about retroperitoneal sarcoma.
With this project, we hope to have enough data to be able to make better decisions in the future and to see for which patients chemotherapy given before the operation would really be beneficial and might even cure more patients.
The path from diagnosis to treatment isn't straightforward, but walking into the unknown is part of the adventure that physicians and patients agree to embark upon when they participate in clinical trials. The results can be life-changing. Beyond the funding the EU has generously provided, it is giving hope to physicians and patients in Europe. What impact does the Pragmatil project hope to have? And how can its therapy empower patients?
We know one of the challenges of actually administering TILs is administering the interleukin-2 after the TILs because of the toxicity that regular interleukin-2 has. So we came up with the pragmatic idea of could we administer TILs in another way that was less toxic? And this would mean changing the interleukin-2. We will do a randomized trial where some patients will receive TILs and the regular interleukin-2 versus other patients that will receive the TILs but then will receive a modified interleukin-2, trying to get less toxicity. What excites me is that we can really change the paradigm of how we administer TILs, so the impact can be really important.
Moving on from the Pragmatil project to the Legato project, which tries to answer this important question for patients with recurrent glioblastoma.
Whether the addition of radiotherapy to chemotherapy prolongs the lives of patients with progressive glioblastoma. I hope that the Legato trial will help to set a new standard of care for the treatment of recurrent glioblastoma by either showing that the addition of radiotherapy to chemotherapy prolongs survival or by consolidating the role of chemotherapy alone in this clinical situation.
The Salvavar project has developed a free online calculator to identify patients with poor prognostic ovarian cancer.
We have done huge improvement in the management of patients with ovarian carcinoma thanks to innovative drugs. But recently what we have found is that there is still a subgroup of patients with poor prognostic because they have a poorly chemosensitive disease and who will not benefit from this innovative treatments. We have developed a pragmatic online tool that any clinician can use based on the kinetics of CA125 that allows to know if the patient has a poorly or highly chemosensitive disease. So then we know that continuing just the same chemotherapy will not necessarily improve her prognosis. So we have to find some therapeutic solutions that can increase the chemosensitivity, and this is what we want to assess in Salvavar project.
Impact AML wants to prolong and save leukemia patients' lives with an effective treatment that can be used anywhere in Europe.
In this moment in Europe, 22,000 people are in this moment suffering to the recurrence of leukemia, and there is no treatment possibility homogeneously in our countries, European countries. The more important ideas that we would like to build up is to be able to treat homogeneously in Europe this population with a very efficacy treatment. In this moment, the expectancy of the life is short in the majority of the patients, but we are ambitious and we would like to find out a treatment that prolongs the life and let me say also to save some lives with a salvage transplantation procedures.
Through these trials, we will have more data driving us to pragmatic solutions that can be quickly implemented, that are low cost, regardless of the country's income, and that will eventually, hopefully, cure these patients with poor prognoses. Together, we're working toward a brighter future.